everybody. My name is Dr. Tiffany Manuel, and I want to just take a moment to welcome you. Thank you so much for joining us this morning, afternoon, depending on your perspective and where you are in the world. We want to just make sure we give you a hearty welcome. Come on in, come on in. I know folks are just grabbing either that cup of coffee for the morning or grabbing lunch, wherever you are in that journey. We appreciate you being here. Come on and settle in. I'm going to start by just saying I'm so excited, right, to be having this conversation with some colleagues of mine around this issue of case making and what does it look like to have a healthcare system that is centered in justice and to make a case for that and the importance of that work. Before we get started on all the specifics of what we're going to talk about today, I just want to begin by just doing some general housekeeping things before we start. You may see that we've got in the Q&A. We won't be taking questions and answers during the panel discussion. We're going to save those for the end. But as we begin our conversation, if you've got questions, throw them into the Q&A section. We're going to make sure we get to some of those, the questions and answers, because I know there'll be many that we'll want to have and respond to. Also, for those of you who will feel so inclined, would love to just have you put in the chat your name and your affiliation and where you are hailing from. I'm Dr. T, and I'm hailing from Orlando, Florida, where it is a sunny 75 degrees. And I like to say that to all my colleagues who are in much colder places where it does not look like that outside. Give you a little sunshiny inspiration for that. But if you're so inclined, go ahead and put your name and what organization you're from and then where you're coming from today. We really have invited a whole set of folks from across the country to participate in this session because it is such an important moment. I hope that you all feel that, which is why, right, you are coming to the webinar today, taking a little bit of time out of your day to have this conversation with us because it is so important. So I'm excited that we're able to have it. So I think those are the major housekeeping things that I wanted to be able to share. I'm going to just get right into a little bit of introduction, and then I'm going to open it up for my colleagues to begin our conversation. So I'm so excited today because I love talking with folks who are doing the intentional systems change work that is on the road to justice. I'm excited to be talking to folks who really do understand that being intentional about how we engage folks is incredibly important, especially in the moment that we're in. It's not just the destination of trying to get to a much better health system that performs better for all the reasons why we normally expect, but the destination, the journey to get there is as important as that destination. And that making a case to get people on that journey with us is really critical, and how we do that matters. So what I'm going to say is all of us, no matter where we are, whether we're directly working for a hospital or a corporation or a health insurer, or whether we are providers in a healthcare institution, or whether we're on the research side of things, on the advocacy side of things, or wherever you are in the space, my inclination is that most of you are here because you are on that journey, that you're thinking specifically about how we get to a much better place. You're looking out in the world and going, saying, we got to do better than what we're doing. This is not working. We know that the sort of dynamism of what's happening in the healthcare space isn't working. We've got great ideas about what could work better, but we got to get more people right on the road, right, to those kind of solutions. So we know that case making is a deeply important part of that journey. That our ability, that narratives matter, right? The way that we talk to folks matters. Words matter. Language matters. Moving the impediments to people's actions out of the way so they can actually hear, right, what we're trying to say and what matters in terms of the journey. And then getting people excited, right? Not just to do this work because it has to be done, but because they're excited, right, about the destination we're after. So my conversation today is with leaders in organizations that are on that journey, right? They're thinking hard about how we transition our healthcare systems and our health systems overall, not just healthcare, but health systems, so that they align with our values around equity and justice. And they're doing the intentional work to be very strategic about how we get other folks on that journey. So this is, I have to say, for me, it's just a love fest. Folks that I'm excited about. And I will say, let me just say as a disclaimer at the front, all of us are on the journey. No, there's nobody out there doing everything textbook exactly right, not even the case made. We're all on the journey. But I think the important point is that we recognize the importance of being strategic in this moment and are sharing the lessons that we're learning on that journey. And so I've invited a group of folks who can help us to think strategically about that, talk about their journey, what's working, what's challenging, what's exciting, what still needs to happen, and what's on the horizon. So I thought I would start off just by beginning to introduce my guests sort of one by one, talking a little bit about how we first met and how they got on the road to case making. And then we'll have a wider conversation about exactly what they're building the case for and exactly the way they're trying to do that. So I'm going to start with my good friend, Bobby Mustang, who is the Director of System Strategy at the Rippel Foundation, ReThink Health, also a visiting scientist at MIT Sloan of Management. And so I'm excited to welcome you, Bobby. I will say that Bobby and I met when I was first on the sort of thinking about, I was at the Enterprise, there's an Enterprise Community Partners. I was doing a lot of housing focused work, housing, healthcare focused work. And Bobby and I kept having this conversation. I'm like, we got to get better about narrative. Narratives matter. Like we may be winning some of the battles, but we're losing the narrative battle. And there's so much opportunity right now to get up and over that. How do we do it? And so Bobby kept meeting and having these conversations. And when I left Enterprise to begin this work, Bobby was one of the first places I looked for a colleague in kind. So Bobby, say a little bit about, what you saw happening, even before the sort of CaseMade was a thing, case making, and this was a thing, and what got you on the journey?
Well, yeah, I'm glad you mentioned the before times, before there was a CaseMade organization. I mean, it is a milestone and an important gift to the field to be able to have a home for case making. I remember the one of the first times that we met, you made an incredibly convincing case for the idea that backfires are real. And I've experienced that in my own frustrations of why aren't we making a bigger difference when, decades or centuries of experience tell us that we can do much better. And you gave an answer to that, which is, our mixture of modern sciences and communication science and narrative analysis and framing. These things are telling us that no matter how much we wish a message is going to get through, it simply doesn't if it's not built to make a case that is going to draw people in. Unframed data or leading with a crisis, which a lot of us have been taught to do, socialized. I have young kids, they can get socialized into a way to tell a story that is filled with options. And by the time we get into professional roles, we're taught a particular kind of storytelling, which amazingly doesn't necessarily bring people to the imagination of what we can do very differently. It reproduces a lot of the status quo. And so the invitation that I experienced from you was how to recognize that backfires are real. And if we know something isn't working, it is unethical, maybe immoral to continue as if it is. So ever since then, that's been my experience of being a novice case maker, is just to not participate in creating the backfires anymore. But becoming a great case maker is a whole different thing. And I feel like I'm still learning about that every day, even in very painful ways. When it's easy for me to start a speech or whatever, I recognize that I'm not doing my very best case making. And anyway, that's a reason that I'm really happy to be in this network with you and so many colleagues today.
Wonderful. Thank you, Bobby. I think that's right. Especially the conversation about the sort of backfires. I think that was what I was experiencing most at that time, which is watching us, the field, right? Not just in healthcare, but also in hospital, and thinking about housing and thinking about climate stuff, watching us try to tee up these conversations and going, oh, no, don't go there, right? And so the first part of the journey for me was just trying to sort of redirect people away from the backfires. But the second part of that was, okay, if we're going to redirect, and redirect to what, and really articulating that has been important. And you've been on the journey with us in that. John, thank you for that. I want to also introduce Jane Erickson, who's also at the Rippel Foundation. And I wanted Jane, especially, Jane and I, in addition to Bobby, had lots of conversations, but what was really important, I think, Jane, for you and I, was thinking about the kind of change that a focus on case making has internal to an organization. And you were really sort of zeroed in on that. Like, it's one thing to be talking externally and trying to get folks on the journey with us externally, but it's also the internal work that has to get done to really make that successful and effective. So I want to talk to folks about at the Rippel Foundation, you are Director of Learning and Impact. And you're also, you direct the ReThink Health's work around Amplifying Stewardship Together project, and many more things that I could probably name that are really exciting for the foundation of ReThink Health. So talk to us for you about how this conversation, the internal conversation actually was important too.
Yeah, definitely. Well, first of all, thank you for having us all. It's great to see a lot of familiar names and new ones. Dr. T and the CaseMade team have been involved in our field work at the Rippel Foundation and ReThink Health for, I think, over 6 years now. And as Dr. T mentioned, she's also been really instrumental in helping us to build case-making capacity internally at the Rippel Foundation. And it's been really transformational, certainly for me, and I've seen this in our staff and the organizations and partnerships that we support. I think really to see case-making as a leadership skill and something that is both related to but really distinct from communications and marketing, because ultimately it's an exercise really in entirely reframing what the work is and why it's important, to Bobby's point, in a way that is rooted in shared values and using language that really is a joyful invitation to join the work. It's been really eye-opening, I think, for us to realize the extent to which it takes a different skill set than a lot of us are taught and that we learn on the job to do this well. For me, it's involved having a different mindset about what we're communicating about, and then really having a different kind of toolkit to think about how to do that communication effectively. And as Bobby said, it's a journey. I feel like 5-6 years in, I'm just starting to get chops, and even then know that I'm really, I feel like a novice case maker, I'll say.
I love that. Thanks, Jane. I love that. And I think that's exactly right. And this, thinking about it not as the communications, and I would say the CaseMade, sometimes we struggle with that, but folks will often come to us thinking about communications and messaging as a standalone thing. And this conversation about this is actually a skill set, right? That, like the muscle, takes time to build, right? So yeah, thanks for that. So I would say one of the things that has also happened in our CaseMade, our relationship with the Rippel Foundation and ReThink Health, has been the invitation to involve a wider range of folks in the healthcare sector in this work, in part through the work that we've been doing with the Rippel Foundation around hospital stewardship and that work. I had the opportunity to meet Elizabeth Dale from Jefferson Health, and Elizabeth is Executive Vice President and Chief Development Officer in the Office of Institutional Advancement at Thomas-Jefferson University and Jefferson Healthcare. And we were in a session together, just talking about hospitals and the transformations that hospitals are going through and what's happening just writ large in the system of care in many communities across the country. And I remember Elizabeth was like, I need more. This case making stuff is really important. And she's like, I know, I want to talk to you about the fundraising part of it. I know there's a larger piece of it, but this is really important for us as we begin to ask folks to support our organization to do some really big things. So I'd love for you, Elizabeth, to talk about your journey, like what brought you to this conversation of case making, what made you say, oh yeah, this is really critical, and I need my entire staff, right, to have this conversation directly.
Well, thank you, Dr. T, for inviting me to be part of the panel today, and hello to everyone attending. Jefferson Health is in Philadelphia, and for those of you that are not familiar with us, we've grown from a 1.3 to a $9 billion organization over the past 8 years. And we're in Philadelphia and among the top 10 cities in the United States. By every measure, we are the poorest, largest city, and we have neighborhoods in our city that are actually the hungriest zip codes. So we decided back in 2017, under the leadership of our president, to put a stake in the ground. So we're in the midst of a $1 billion fundraising campaign. And in 17, we said, okay, we're going to raise $100 million, not for a new building or scholarships or professorships, but to improve the health of our communities. And all of those funds that we raise will be reinvested directly into community efforts, such as opening a primary care facility for refugees and folks in our community that are undocumented, such as a stroke center in North Philadelphia, really focusing on African-American men. So this was a bold thing for us to do, to set a goal of $100 million, and we're approaching $50 million now in total funds raised. And we partnered along the way with the Rippel Foundation, that we understood what we wanted to do, but we really needed like more of a philosophical underpinning. We needed language. We had a series of workshops over the course of a year with the Rippel Foundation, and Dr. T was featured in one of those workshops. And I almost immediately wrote to Rippel to get permission to engage Dr. T as a partner of Jefferson, because as fundraisers, if you read Dr. T's book, she makes the point that it's storytelling, and storytelling is so part of our humanity. And when we want to secure a major philanthropic gift, it's not the proposal, it's not the numbers, but it is the story. It's the story of merging the benefactors' story with our story, with the story of those that will benefit from philanthropy. And as Dr. T mentioned, narratives matter. Like, narratives matter so much to a fundraiser. I mean, that's what we're doing. We are storytellers, and the more effective we are in telling the story, the more money we will raise. And so we engaged Dr. T to work with our entire frontline staff to reshape how we tell our stories. And through her workshops, we've been able to not only recast our conversations with benefactors, but the materials that we prepare, both electronic and in print. So it's really been transformational, both our partnership with Rippel and our partnership with Dr. T in raising funds, especially for this organization we invented as a fundraising umbrella back in 2017, the Collaborative for Health Equity.
Wonderful. Thank you. Thank you for inviting us on that journey. I appreciate that. And I also wanted to also introduce Ruth Thomas-Squance. Thank you so much for being here, Ruth. Ruth and I also met. It's almost a very, incestuous kind of like love that's happening here, because we're all families in some way, shape, or form, and all of us are meeting in the same rooms, right, in the same kind of conversations and meetings. But I met Ruth in many of the same ways. We were working on a project together that was really about how do you bring housing and healthcare systems together, and what's the overlay, and what's the sort of data and information that we can best use to help those sectors speak to one another, right, when they both have their own unique individual language. And we're working on a project to sort of bring that together. And so over a number of years, I would say that sort of strong case making about how do you help these sectors who have every incentive to be stronger partners, but often are not. How do you help them to sort of make those partnerships happen? So Ruth is the Senior Director of Field Building for Build Healthy Places Network, a longtime partner and friend of the CaseMade. And so I'd love for you to say, Ruth, a little bit about what brought you all to the sort of case making journey as well.
Yeah, sure. Thank you. And thanks for the invitation, Dr. T. And it's great to be in such great company and like-minded individuals on this journey. And again, I would agree with what other people have said. It feels like a journey, a skill set that you don't ever stop developing and refining. So as you mentioned, I'm leading the field building work at the Build Healthy Places Network, and really our case-making work, revolves around this work that we do at the intersection of community development, healthcare, and public health, and sort of really trying to change how the sectors work together to really leverage community investments to sort of, and also shifting that mindset to move upstream to sort of move away from the sort of reactive problem solving of downstream interventions and sort of thinking about that system change. So in terms of the field building, there is a lot of case making in terms of changing a sort of, as you mentioned, that sort of cultural shift that each sector has developed that has created very efficient ways of working within sectors, but really isn't working across to make a stronger case. And one of the things I think I've seen in the time that I've been here, this evolution of the journey is I quite like the sort of framework, Upstream, written by one of the Heath brothers, and I forget which one, I apologize. But that book sort of, where they're sort of mentioning how, you get a problem blindness and there's a certain belief or a sort of acceptance and comfort with some negative outcomes that happen as if they're just natural and they occur. And I think that, we're trying to move this framework where it would be, people that look like you and I, Dr. T, are just sicker or are just poorer. And to sort of start interrogating what are the systems of, structural oppression and structural racism that have created the environments that bring these outcomes. So that sort of case-making shift, I think, has moved us to a growing awareness around health equity. I think there's been a great increase in thought about health equity coming out of the pandemic. And I think so for one of the changes for Build Healthy Places, I think, has been that shift towards centering health equity in our conversations, to sort of explicitly mention it rather than have it sort of implicitly implied that you're doing good work, you're going to see the changes, to sort of call that out. And sort of, I think by centering that also, I think it changes the solutions that you discuss and the solutions that come to the front. So two of the big shifts for us have been in terms of centering health equity, and then shifting towards community engagement, or I like to add meaningful community engagement. As you know, there's many ways to do it, and sort of and encouraging that change from community, sort of informing to sort of a community partnership. And I think that the case-making steps really sort of, they help move you along that journey, I think. So, it's been really
yeah, absolutely. Yeah, so I want to now just sort of do a little popcorn and sort of ask some questions and allow you all to answer as you feel led. And I may just pick it up, Ruth, from where you were just sort of, to naturally kind of sequence from where you were just talking about. But I think that's exactly right, that it's thinking about those principles into the case making in terms of how you get people to be more aspirational, not sort of focused on the problems, which is easy for us. And we are really, as a sector, healthcare especially, very centered in health disparities. We like that's the language that we start with usually, and we talk about what's wrong and who's not well, and right, because we're trying to fix those problems. The case making really is a really different way of thinking about how you engage people, that we want to get people excited about the journey, aspirational about what it could be, and setting the vision like high enough that people can look even above solving this small problem, right, which may be about moving this widget to here from there, to thinking about how do you get to systems that are just, like what does it mean, right, to be much more aspirational. So I'd like to ask, just a general question. We're talking about this issue of justice. How do you think about, or what does it mean to you when somebody says we're centering the healthcare system around justice, or a healthcare system that is centered, right, in justice, and that especially from the vantage point of that aspiration? I don't know, popcorn to anybody who's open for that one.
Well, I'll jump in. I know I've just spoken, so I promise I'll give it the mic after this. But, I think for me that I love seeing that move towards including justice in this, this idea of justice, because I think it encourages that sort of adaptive challenge to interrogating those systems that are in place. And I think that leads to a more sustainable change. I think that, obviously we do need to continue to address, health and social needs, but that shift to sort of mindset of like preventative approach that centers around justice sort of thinks about imbalances in systems that create these disparities. I mean, I find that shift sort of encouraging. I don't think it's as common yet, but I do think it's gaining ground, and I think it just encourages adaptive approaches to to solving the problems that we see.
We go back to, go ahead, Bobby.
No, please, you first.
We go back to Dr. T's book, and it's about we, and the we in a health system is a pretty large collective of people when strategic decisions are made. And so there's the administrators and the faculty of the health system, but the other side of that equation is the Board of Trustees. And it was pretty bold of us to say, we're going to raise $100 million to narrow the health equity gap. And the Board of Trustees needed to be educated that the benefactors that would support narrowing the health equity gap in the city, there are different subset of benefactors than those that want to put their name on our new building. And through that education process, the board really came to endorse our obligation as a health system to be on this journey to address health inequities and to narrow the gap, and to listen so carefully to the communities as we worked with them in full partnership to develop these programs. And so I call it echoing when we hear our own words coming back. And our president and CEO that really put the stake in the ground to challenge us to raise these funds, he retired in December, and now we're searching for a new CEO and president. And in the position description for this new leader, it is very clear they are expecting a leader to come in not only with a commitment to addressing health inequity, a commitment to working with the community, but it's way up there in the introductory paragraph. So it was such a great reinforcement for me of the messaging and the case. We had to make a case a number of years ago, and for the board to so clearly articulate this as an expectation, it means our work will continue on, because in our ecosystem, the board really drives strategy with the executives.
Yeah, I mean, your question about the significance of organizing around a concept like justice is a big deal in an industry where a lot of us have been socialized to the idea that prevention is kind of the highest ideal. If we can just prevent problems, people would be better off. But first of all, we've had a lousy track record at actually making that happen. Decades and decades of solid prevention science hasn't really materialized into a public mandate to prevent bad things. But a deeper issue is preventing bad things is almost a different kind of work than actually creating things you genuinely value. And as Ruth said, we've got structures that were built that were never built for everyone to thrive. And so even preventing like a long list of bad outcomes is not the same thing as creating a system that's designed for justice. And I'll just say one other thing here is like the idea of creating justice or solving big problems is a big part of American like sort of idealism and identity, right? We have a history of pragmatism. Establishing justice is in the preamble of the Constitution. We've never lived up to it, but it's a promise that we can, sort of persist toward. And there's a piece of communication science that I find fascinating that lots of Americans will strongly endorse solutions to problems that they don't even believe exist. They will say, oh, we don't have racism here, but if there's a way to actually dismantle racism, then sign me up for it, I'll do it. Like, it's amazing that we will get behind solutions, even if we disagree about some of the premises of it. And that's, I think, because people want to participate in doing great things together. They want their work to mean something more, and not just because it happens to benefit people who are burdened. It's because we all benefit when we create things that we genuinely value. And the move that we're trying to make as casemakers, I'll just speak for myself, as a person or in the organizational networks that I think are represented here on this call and many of the participants, we're trying to create a system that's built for everybody to thrive together. And that means all of us have work to do to contribute, to make that happen. It's the bystanders that are not doing as much as they can as stewards in that movement that we really need to win over. I'm not trying to convince people who disagree with the idea that we should be thriving together. I want the legions of other bystanders who could do more to animate this movement to do things we can't do yet. And establishing justice is a pretty high on the list.
I think building on that, Dr. T, the invitation that you've given to all of us to really anchor our cases in optimism about solutions instead of dwelling on problems has been an exercise in thinking about what words resonate in a deep, visceral sense with all of the types of leaders and organizations that are involved in doing the work of system change. We know that that's one of the biggest barriers to really moving the needle on, towards the kind of outcomes that we really care about, is that this work doesn't happen with one organization or one sector. And a huge issue is that a lot of times a particular group doesn't see themselves in the words and the language that you're using. And so we at ReThink Health and Rippel, and with a lot of partners in the field, really have focused on using words like thriving together, building belonging, things that are both a process and an outcome, and that you as an individual know what it feels like. You know when you're thriving. You can look at a community kind of on the whole and be able to feel viscerally whether others are experiencing those things as well. So it's a really effective way, we think, to be sort of widening, again, I'll use the word invitation, in a way that feels really grounded and actionable and inspirational for people to join in the work with you.
Love it. Boy, so much good stuff there. we can talk about for each of you, all the things that you just shared. Just incredibly thoughtful. And I, as you all were talking, I'm like, oh, these are casemakers. That's why the conversation is incredibly thoughtful in all these kinds of ways. I want to pick up on just a couple of things that y'all have said and maybe push you all a little further. I just, one of the things that is often challenging, especially for folks who are in healthcare, and I think all of you have said this in some version or fashion, but I just really want to sort of hit on this really, really carefully, is that the sort of case-making journey is one that is about aspiration, that puts our sort of visions forward, that starts, that anchors solutions, that anchors us in the future that is possible. And oftentimes, I think, when people first sometimes start the case-making journey, they sort of bristle at that because we've been sort of indoctrinated to some extent in the way of thinking that is about problems first. We're solving problems, so we really have to do a good job of painting the problem as it is, very thoughtfully, and to take a lot and to use a lot of our energies, right, in terms of enrolling people in a very problem-focused way. And case-making asks you to start in a different place, and I'd say that's one of the things that we often get initially that's really hard for folks. I mean, it's like when you get it, you get it, but it takes a while for folks to sort of make that switch. We were, in fact, my staff and I were just working with the team just about a week or so ago, and we were talking about data, and we're taking all the sort of negative data they had and turning that around. And they were like, they were starting off, unfortunately, that the data, the statistics is this, and I would say, okay, start differently, start the conversation, say, fortunately, and then what are we fortunate for? They were like, fortunately, you can't say that. Like, yeah, right. And I think that relates to what y'all talking about. Bobby, you were talking about the communication science, about how our brains actually respond differently, right, to a solutions-focused message, to something that, and even Elizabeth, you're talking about the sort of bigger sense of our brains function, like all of the principles of case making are meant to sort of attend to the way that our brains, like in cognition, function. So I just want to talk to y'all about that. I mean, that can be kind of wiry. I mean, in an organization and in a field where the current is in that moving in that direction where people are talking about problems constantly, consistently. They've got lots of data and swimming in the pool of that. So, being able to do that. How has that been for you in your organizations and in your work to be swimming upstream, if I can use that way, in a little bit of a different way, but to be swimming upstream, right? Having a differently focused message in the work.
I can share just a personal experience in terms of, as a reformed research scientist from the past. I mean, I totally resonate with what you say about the training and our approach, in biomedical research, as in healthcare, is to sort of, you do a good job of painting the bleakest picture possible about the disease or whatever you're working on, and then you move on to sort of some data and what you're doing. So I personally find that I had to make that shift. So I think, both that you're saying, it's interesting what you said. I just want to say, but from the individual level as well as the almost cultural shift within an organization. And in terms of, I think, approaching it, I think there is almost I think somebody mentioned that visceral response, that opening up of the possibilities that come when you move from that sort of very tight, restrained, zero-sum game of just, problems and the we them.
I can jump in with some things that we've been learning from our evaluation work of all of our work at ReThink Health and Rippel over the last 3 to 5 years or so. We've seen, I think, building on the assumption that if you want to do equitable system change, so changing the conditions that are holding massive problems in place, you have to start with changing how people think and act and how they're in relationship with one another. And we've seen that using this new language and framing, so really starting with shared values and leaning into a sense of optimism and energy, can create new ways of seeing things. And when you do this across a team, within an organization, across an organization or a network, so a local partnership, you see a whole bunch of people start to talk about things differently. You see them framing goals and possibilities differently. And we see then a direct connection to those shifts leading to changes in organizational strategy, strategies of partnerships, changes in what you invest in, and even policy shifts. So I'm drawing a very explicit line between the very impactful kind of effects that we see from just using, it feels small, but it really is, it creates a sea change in how people see the opportunity in the work to be done.
Yeah, I mean, I think we're echoing each other in many ways on this question. It's if you're exposed to a repeated list of my crisis is worse, the people that I'm thinking about are worse off than yours. I mean, there's always this ever-present, like, shifting claim of attention that this issue is the most important. And if you go against that script and actually give people a sense to feel what it's possible to participate in creating something that they want, it's not a cognitive appeal. It's first and foremost an emotional opening to say, yeah, this is hard work to create a system that wasn't built. And we're some of the questions in the chat, Jennifer's question about that, we've got historical legacies that have been resistant to change for a long time. It's not as if other change makers haven't been trying to make a difference. We haven't really developed enough public will to be able to enact changes that we most want. And some of that is because the change makers are all arguing for their own separate issues, as opposed to unifying around things that we most want to create. A system that's built for justice is a multi-solver. It's going to be good across a lot of range of issues. And so when we're working across scales, giving people the ability to think not just with their head, but with their heart and their hands, to participate in something different, you've got them in a very different place if your first engagement is around something else than just a you know, the activated script that says, here's somebody new telling me about their issue, and now I got to decide, is this going to be my issue? And I don't know, Elizabeth, you might say more about what this is in the donor relationship, but you're trying to draw capital to things that historically people haven't even valued or haven't even been visible to them. To me, that seems like an important place where this case making is really going to test whether people care first and foremost about the issue that, you know, that historically they haven't been.
That's such a great point, Bobby. What we say is money matters, and if you want to translate your vision into action, you need to have resources. And part of what we learned at Jefferson through our relationship with Rippel and Dr. T is this whole concept of the vital conditions. So it's not just your health, but it is your housing, it is your access to food, it is your access to safety. And, you know, we call ourselves a collaborative, and collaborating is really, really hard work. I mean, we received a $5 million gift from Ken and Andrea Frazier. Ken just retired recently as the CEO of Merck to create a stroke center in his old neighborhood in North Philly. And we took half of that gift, $2.5 million, and we actually gave them $2.5 million, $1. We wanted to give them more than us, but we gave half of that gift to Temple University. And we are running this stroke center together. And in the health marketplace, we're competitors. And now we're working together to solve issues in conjunction with a community, but Temple's closer to that zip code than we are, and it just made sense. Collaboration has much better outcomes, I feel, but it's really hard work. From the vital conditions, we realized how important housing was. We had an anonymous benefactor make a $5 million gift. And this is a great story. At the end of the solicitation, which was my first meeting with him, totally on Zoom, he said, I'm going to give you $5 million, Elizabeth, and use it as you see fit. And so we formed a partnership with Habitat for Humanity, and they've renovated 600 homes already in Philadelphia. Another nonprofit called MANA, and they deliver 2 million medically tailored meals every year. And Jefferson is providing a community health worker, and we have a pilot launching very soon. We're going to renovate 25 homes, provide community health worker support within the home, and in addition to that, provide meals with the goal of helping folks understand the importance of good nutrition. So, you know, going back to the narrative matters, and if we use the word collaborative, then we need to collaborate, even though it is harder than doing it yourself, but the outcomes are so much better.
Yeah, love that. Love that. So I want to piggyback even a little more on that. One of the things the way I often frame a part of what I heard you all saying in many ways is case making. I say case making is energy work, right? You're shifting the energy and the entire relationship and the conversation so that people feel aligned with it. There's a deeper sense of kind of head and heart in the conversation, in the work. And when you do that, as you were just talking about, Elizabeth, the outcomes of that are so much richer than they would have been in a very problem focused, like, right, it's trying to just solve for this thing right here, as opposed to that. I'd also say case making is also power shifting work in a number of different ways. And I think about just the power dynamics and the relationship shift when you make a strong case that's really centered in a conversation around we. It also changes those dynamics. I'd love to have you all just think about that for a moment. You know, justice itself is about power and power shifting, but the case making part of that, for you, have you experienced case making as a power shifting vehicle? And if so, talk to us about how that's landed for you.
I'll just say one thing. I alluded to the fact that this is like really personal. Once you know what good case making can be, it's like you can see a lousy case a mile away, and to be able to start differently with the we and the why is a power move. Like, I mean, if I start with my solution, or if I start with the way I choose to frame this issue, personally, because it matches my expertise, or it matches an issue that I want to advance specifically, I'm not really inviting other people's creativity. I'm not drawing them in to do something that I can't do. So, and the muscle memory of doing it that other way is because of socialized into positions of power. But if you can actually focus on something much bigger than any of us, and I'm talking about bigger, there's a marvelous quote from a Native American leader who said, if you're working on something that you're going to complete in your lifetime, you're thinking too small. I'm talking about like things that we need intergenerational movement to make happen. If you're going to call people into that work, we should really be able to do that at the moment of every interaction, right? That this is bigger than all of us. And here, the humility and the ambition of that can come together. And that's not the way that power is normally orchestrated.
Yeah, I so agree. For me personally, case making it's not about being right. It's not about being the best or even about proving a point. It's about framing a conversation that, again, I'll use the same word, invites others to join. And it's such a different dynamic. The tone is different. The things that you're emphasizing are very different. And, even think about personally, if you get in an argument with a friend or a spouse, it's such a different thing if you are in dialogue around doing something better together versus being in dialogue to be right or to prove a point or to win. It reframes all of the possibilities, which is inherently about seeing each other eye to eye rather than putting someone or some organization above somebody else.
I love all that's been said already around this, and I think one of the things that we encounter as an organization that is working with the community development sector to approach healthcare sector, there is that power dynamic between institutions that are the experts in the room, and to sort of acknowledge that sort of shift or the diffusion of power of working together in a partnership, and to recognize, I think, especially what community brings as expertise and knowledge and lived experience, and that sort of diffusion, but shared power that comes from, making the case for that is kind of a powerful shift to experience too, I think, or sort of reframing how that approach is taken to shift to a higher ideal. I think I like what Bobby said, and one of the things I heard, I think it was Angela Glover Blackwell say, equity is the superior growth model, and I like that sort of shift to sort of what we're gaining from this change.
So I love that, and there's so much good stuff to say here. One of the things that I had sort of heard, especially about it, and early on, you were just talking about when you, knowing the skills of case making, when you can see other people trying to make a case, and you can see when they're just right, because once you know kind of what works, when you're looking out at the field of folks who are trying to do this work, you can kind of see when it's sort of careening off the path, right, of what will actually bring people to the table, and also alternatively when folks are really hitting it, like you can see. You can see it in the outcome, but you also can see it in real time as it happens. And so I wonder, just for you all, what's that experience been like? I often say in some of our work, when we get through with the workshop with a group, I often say, I hope that I ruin you for life, in the sense that, every time you start to make a case or you're talking to folks, right, there's something, this little nozzle that goes off, and I can't do that. You can't be starting with that negative data. That's not going to bring anybody there. You can't be starting with. right? Where are your solutions here? What, right? Or even when we teach people around things like how to pivot, like the art and science of a pivot and how you do it. I was on a call just last week, and one of the folks on the call was saying, I get it. And I was in a meeting, there's a city council meeting, and I watched somebody trying to pivot, and she was like, oh, you're just doing it all wrong. That's not the way to do a pivot, right? And so she was having that kind of moment. But I just wonder, as you all are watching some really great work in the field, try to get off the ground, not just your own, but other folks, and you're watching that sort of happen. Sort of what's your reactions to that? What's, advice and counsel for those of us who are also trying to help our friends and colleagues sort of make the shift to what's working better.
I think Bobby captured it so well when he talked about muscle memory, because, if you've done something one way and that has been your frame for many, many years, thinking about being conscious in how you make the case, it takes a concerted effort. And for a while, I had an image of Dr. T's 10 fingers, like taped to my refrigerator. It's kind of like a little reminder to me, because it's not only making the case to the benefactors, but, in a health system, like you're always elbowing for your part of the pie. Like, what is your budget going to be this year? And we're a revenue center, which gives me a little bit of an edge, but I actually had written a memo to the CFO making the case for an increase in our budget. And it just didn't feel right. And then I went back and rethought and looked at my notes and looked at those fingers. And I thought, wrong approach. And I rewrote it from more his perspective and the we perspective and really going to why. And our budget was restored. So I also sometimes, I never realized that as a parent that you still keep parenting when your kids are adults. And some of these skills help one parent adult children.
Mm-hmm.
Yeah, I mean, one thing that we've noticed is it takes more than one innovator to make this happen, right? So a very specific example, in a group of organizations, we were trying to build our collective capacities in case making, and one group was so interested in doing it, but they were particularly involved with lobbying and engagements with policy making. And they were saying, but the policy maker script is you have to be quick and lead with the problem and give us your solution. And that problem script was so ingrained that even if they alone wanted to, lead with a different case, it was really hard because the audience was expecting to receive information in a very particular format. And then we've begun to see over time that there is a beginning mandate, even among the policymakers, to reframe the bigger project of what they're doing, to become more involved with what are they creating. And so when the lobbyist and the policymaker both realize that they're looking for something different, then a new kind of paradigm of case making can take hold. And we see this all the time with innovations. It's not just like the one innovator that can get everybody behaving differently. It's clusters of them who agree to do business differently together because they're working on a different project in a way. And that's how innovations start traveling. And now the next new lobbyist, the one that was doing it the old style lobbying way, they're going to be the one that stands out as not being down for the project of, building centering our healthcare priorities around justice. That's how innovation spread in networks, and it's much easier said than done. But it's got to be plural innovators at once.
Yeah, I think building off that, Bobby, do you also sort of think that there's also that moment in time, there's that context of timing and referring back to this sort of inflection point that Dr. T mentioned that a lot of systems change, a lot of awareness, perhaps our attention being held a little bit longer during COVID as a captive audience, focused on these things, that in combination with that sort of cluster of people wanting to make a change offers a lot of potential for this to be a specific moment to make systems change.
Great. So, as I'm looking out at the kind of on the horizon, I think I see it probably, as par for the course. I just see so much opportunity in the current moment where there is just a lot of dynamism in the field, right? Some might call it crisis. I just call it, right, the call for adaptive leadership. It's a call for folks who, in the midst of a whole series of things that are happening, some might call them crises, right? But they're just, right, they are the things that have become our lives, right? The environments around us are needing us to be present and attentive. When I sort of look out at that, I see lots of opportunities, because I think when we are in the midst of so many challenges, crises, whatever you want to call them, there's also a willingness and a desire for folks to come together and make some new agreements, to make some new, they're open to possibilities that they may not have been open to before, because out of just the sheer necessity, they say, it's a mother of invention. And so I want to know, as you all are looking out in the spaces where you are working, right, what are the places where you just see a lot of opportunity, right? Even some might say in the midst of a lot of chaos and crises, but a lot of opportunity to make a strong case for justice being centered in what we're doing in that larger aspirational way that we've been talking about. What's on the horizon for you? What do you see as possible?
Well, at Rippel and ReThink Health, we are in everything that we do in terms of how we work with organizations and partnerships, in the research that we do, how we talk about stuff. Everything is anchored in the idea of thriving together and building belonging. And really importantly, when we think about our own capacity building support, and when we talk with folks across the country around what they feel they need, the idea of narrative change has really gained a lot of traction lately, and this is how we tangibly think that takes place. It is about strategic case making, and I think notably there is a lot of times when you introduce new ways of thinking and acting, you can get pushback from groups. That is absolutely not what we have experienced here. That pretty much across the board, there is a thirst. People understand and experience individually that they can be communicating and talking about things in ways that will really help to change how we're doing things in a way that's going to really help us to reach the radical change that we all want. So I guess the punchline to that is we see the opportunity everywhere, and I think that there is incredible enthusiasm, Ruth, to your point, specifically in this moment.
Yeah.
One thing I think that we're seeing, or one thing that's currently happening with us, so we're creating a multi-sector playbook for rural healthcare to look at investing in cross-sector partnerships, and incorporating the vital conditions that have been referenced earlier, sort of really as a way of, I think that there's a lot of interest in thinking about health equity now. There's an increased awareness around it. How that's implemented in the real world outside of the hospital, how's that implemented in community can be, I should say, a little vague. And I think that's one of the great things about, the vital conditions is that they're, it's tangible talk about change, humane housing in particular, around something, and thrive in natural world. So, meaningful work. So those kind of engagements are things that you can get a handle on, and very helpful, I think, and strong in case making, because it's sort of very tangible. And I think for us, it's sort of in terms of we're talking about timing and moments. There's the COVID. I think that rural healthcare had plenty of struggles beforehand. And then getting sort of hammered during COVID was very challenging. And I think it's kind of exciting to see that the case we're making is to play to the strengths of rural rather than hearing the laundry list of deficits of rural. It's not urban. It's sort of describing everything that it's not, rather than describing what it is and what those assets are. And for one of the things we're proposing and supporting in this playbook is this idea of the interconnectedness of the social structure and fabric really plays to the strengths of working together in some of these broader sort of, adaptive sort of approaches. And I think also incorporating, coming back to what we've said earlier around health equity and health justice, of making this an inclusive recovery process. So of rethinking is also something pretty exciting that we're thinking about. So that's just something that comes to mind as, I feel like a very positive possibility in case making.
Dr. T, may I just jump in
I'm
on that topic? So I straddle two worlds, really, living in the philanthropy world and living in the health system world. And how fortunate am I that when I started at Jefferson, the new president created what he called the 4-pillar model, and he elevated philanthropy and innovation to have equal status with the university and the whole health system. So I've been at the table from day one in this small cabinet, which gives me a very unique perspective. And so maybe 2 weeks ago, I went to Miami to a conference called VIVE, V-I-V-E. And it's a conference of chief information officers for health systems. It was my first venture out to an event with 5,000 people, and everybody was tested before we entered the convention hall. But this is fascinating. And the reason I went, so it was 3.5 days of programming, and they had what they called the tech equity track. And 3.5 days, there were all kinds of seminars and presentations by companies that are focused, emerging companies at all stages, from doctorpreneurs having an idea through City Block, which is a pretty well-regarded for-profit company looking at how to reduce total cost of care and actually make a profit. So I think that this issue of health equity as a result of the pandemic has really been accelerated on the minds of folks who live in that intersection of healthcare and technology. And I think there'll be solutions, platforms, incentives. I'm really looking forward to the future. This is like kind of an emerging field, and I was so glad I went to that conference, because I've made contacts with some really interesting people, and now we're starting to follow up. But that how technology is going to play a role in helping us narrow the health equity gap, address the vital conditions. I don't even think we've begun to imagine what that could be.
I'd like your question, Dr. T, about the near edge of the transformation that we're working for does have signs of optimism. It's not just that this is a moment of, sort of both crisis and opportunity, but there are even now signs of big institutional change that have begun to step into the opportunity side of that crisis, and not just the snap back to business as usual. And the two I would cite are just the unprecedented amount in size and flexibility of resources that are flowing from the federal government to states and communities. We have never seen this in our lifetimes, really, in American history. This amount of money, it's still short-term, but short-term playing out over 5 years, and flexible within guidelines, but more flexible than any of us have ever seen before. And how we make the most of those resources to actually treat this like a legacy moment, to do things that historically we've never done, and look at the abundance rather than the scarcity. If a lot of money helps us see even more abundance and the possibility of how we've been excluding people from this work, if it helps us build the belonging and civic muscle that then amplifies us to do even more after those monies are gone, how do we use this moment to reshape our priorities for the steady state dollars that come, that are always baked into our resource commitments? And that's my second sign, is the we've referred here to focusing on vital conditions, and there's a springboard for thriving together that a lot of non-governmental partners, Dr. T helped frame the opening pages of that, and it is a case for seeing that even we can convert loss into renewal, and how to do that, by being true to our values. And so that springboard was a non-governmental voice. Over the last 2 years, there have been 31 federal agencies have been diligently thinking of what are their commitments to long-term equitable resilience, and are also using that same framework around vital conditions to identify what they believe are the priorities that should govern a new relationship between federal and sort of federal agencies and the people across the country who rely on them for support, and that can open a new thing. So this is forthcoming in April. I put a link in a chat to sort of a recent update about their process, but we haven't had that kind of alignment of stars to be able to see that we are together working in a movement. And the only really rate limiting factor is that sense of belonging and civic muscle. Who feels they belong and who feels that they have things to bring to this work?
That's right. That's right. And I want to just offer something there. I love that sort of belonging and civic muscle. And I think about the moment that we're in, and the opportunities I see, especially around sort of building broader public will, or just people's willingness to be involved in these conversations. I think some of these conversations can feel like we're sort of talking heads and thought leaders in the space, and that everyday people are being left out of that. And I think one of the things that is really core to case making is really trying to be radically inclusive in our efforts, like bringing folks to the table who never thought they'd be at those tables, who some might not have felt they even should have a place at those tables, but reminding them that they really do. And I would say even talking them into, not out of their power. There's so many ways in which, from a narrative perspective, people are talking themselves out of their own power. My staff and I, we were working with the team. We often do what we call community voice sessions in different parts of the country to listen to folks, hear the narrative and language people are using, and then give an assessment about where some of the case making work could and should land on whatever issues they're working on. And I'll give you an example of one of the narratives that we often hear that comes, from folks, this sort of conversation about the haves and have-nots, right? People will give that often, like as a dominant narrative. Well, listen, I'm in this community, but the people in this community have resources and wealth and power. They do what they want to, and we're just the have-nots. I don't want to get involved in all that stuff, healthcare and housing and all that kind of stuff, because right. And so they're looking at the world in front of them, and sort of, some of them are, they have been disempowered, have been disinvested in for many years, have, don't feel a sense of inclusion at the tables where decisions are being made. And so that has become the way that many people in our community think. And so, part of the work that we've done in those circumstances is to give sort of some remedies to that from a case making perspective. How do you have people not talk themselves out of their power, but rather talk themselves into it, right? And there's a process for how you do that. One part of it, I think, that is core, especially at the springboard writing, was about helping people remember, right, the times when we've done things well, like, right. There have been times in our history where, like, we actually did stuff that was really powerful. There was some really powerful stuff happening, even in the moment that we're in. And Bobby, I appreciate your comments on that. Right now is a really powerful moment where things are happening that are historic that we've never done before. And this is happening. That's really helpful. But talking folks into that, because when they can connect to that sense of, hey, wait a minute, we've done some pretty powerful things, and now we need to transition that to something, the next, thing. It allows folks to be more powerful at the table. So I just love that, and I love the idea of that, sort of that being a muscle that you get people into the spirit of that, and that becomes, as you all talk about, as a multi-solver. It's not just relative to the healthcare conversation. It's the housing conversation. It's the climate change, when people get to see themselves as really powerful in the space. they bring that to every conversation, to every relationship, and allow us to collaborate. So I just wanted to echo that back to y'all as the opportunity that I see, just an amazing opportunity for us to begin to talking people back into their power, not just those of us who are in institutions where we have, right, titles and formal, right, but folks who have no titles, right, they, right, in a formal way, they don't have the gravitas of having been at these tables before, but they certainly are folks that need to be there. So.
Right, absolutely.
Yeah.
And I think also, you know, I'm thinking also building off what Bobby said, that what is also different or interesting to me is to be in conversations not only of the unprecedented funding, but sort of paying attention to where it's going and how is it reaching, some of the sort of areas that are sort of persistently missed, and how we can change that, you know, so that we're not sort of following sort of well-worn paths, but actually thinking about how that can be seeding different solutions in different people. And I think buying into that knowledge and power that's brought from community, impacted community.
Mm-hmm. Absolutely.
Yeah, I mean, I actually have a question for you, Elizabeth, on this, because it's in some ways there is a fatigue about, we're faced with all kinds of problems, and some of these problems you can't throw money at to try to solve them. I mean, it's just like the donors that you're talking about, and we can enlarge that to a whole class of other people who hold the purse strings over resources. I think at some level they've eroded all of their goals because they're just trying to do the you know, things that seem direct value for their program or project. Nobody's sort of oriented toward building a movement. But one of the things I guess I'll phrase this as a question, is a curiosity, is how you've been able to explain that when you're not using a philanthropist's resources to build more hospital, but you're doing it to build belonging and civic muscle in communities, then that becomes an investment that they can convert into stroke prevention or, you know, a variety of other things that matter there in that neighborhood. So the resourcing equation there is invest in building belonging civic muscle, and that investment will yield more than you can imagine as it converts into other areas of work. And we haven't seen investment in belonging civic muscle as an investable thing, right? It's been a sort of blind spot. I invest in stroke prevention, but not who's doing the stroke prevention and where and for whom. That's a different question. I think I'm hearing you say that, Ruth, but I don't know, Elizabeth, has that been your experience, that you're kind of converting dollars into belonging civic muscle, which then convert into, you know, system change?
And I think our ambassadors along the way, we have, in fact, it's been part of my development work. I've been chief development officer now at 3 places for 20 years. And from the very beginning would create advisory groups. And the advisory group for our creation of civic muscle and focus on health equity has almost taken on a life of its own. I mentioned this in the Q&A, and so we have a group of really powerful, wealthy philanthropists and local business leaders and leaders of some of the most substantial nonprofits in the city, that we planted the seed, like we planted all these seeds and put all of these people together, and they now have taken our network, their network, and they realize that this is a much larger problem than, you know, even if I raised hundreds of millions of dollars, that we could not really solve. And so this group is actually engaging McKinsey, the consulting firm, on their own with their own money to take a look at like the underlying business plan. They're calling it a business plan, but the plan that's needed to start to really address health inequity, the vital conditions, civic muscle. I mean, it is such a huge undertaking in a city like Philadelphia that has suffered for the last 100, really. I've been reading the history of the city in Jefferson because we're about to celebrate our 200th anniversary. I mean, these problems go back for a century, and beyond. I never imagined this happening, but like, this is how we're really going to make that systemic change and create the kind of community that help create the kind of community we all envision. I mean, Margaret Mead said, never doubt that a small group of committed individuals can change the world. And indeed, it's the only thing that ever has. And we have this small group of, there's like 7 or 8 people, and they are putting their time and their money and their effort and their attention into this initiative. So thank you for that question, Bobby.
Yeah, love that. Love the crossover of that. And too, I think this is a point too that Jane had made earlier, that the outcomes, that's what you're talking about, the outcomes of when you are making a bigger case, the outcomes of that are so much bigger than what they would have been if you were, right, sort of just making a narrow case to one group of folks. And sometimes you can't even predict, like, the larger outcome of that because, right, part of it is that you're just including more folks, right, with different perspectives and talking differently and engaging people differently, but you can't even predict what those outcomes will be, which is, to my mind, one of the sort of, additional benefits of thinking about case making. So I'm realizing that we're coming slowly to the sort of close of our time together. What I thought I would do is maybe grab a couple just general things from the chat, and we could sort of, popcorn a few things that were top of mind for folks. And we'll try to keep our answers short so we can grab a few of these before we segue and close today. So one of the things in the chat was just about level of commitment, right? That, there is this, the way that I think of the commitment question is, Bobby, to your point, the justice and the, things you're working on, it's a long trajectory. I mean, we are unlikely even to get to where the vision that we all have around justice in the health center and healthcare sector in our lifetime. So we are really doing work that is multi-generation, right? Supposed to, right? That will hopefully carry over, right? In that context. And oftentimes, our sort of policy making work is often the short term, often, as one of the commenters said in the chat, the researchers are, come into communities and do research, and it's really short term focus. It's like you get, 2 years of funding to do something like, right, or 3 years of funding in this community. They come in and do a little work and they leave, and then, right, you're back to where you were before. I'd love for y'all to talk about just the sort of, how you've experienced that conversation, both the short term, often opportunities that exist in our space to do some really big, important work, but really the longer term journey that we're on and sort of what that looks like to help our stakeholders, right, be in it for the long term, not just for the 2 or 3 years that you get a little funding from this foundation or that, but the long term journey. Any thoughts about that?
One of the things that struck me was, I think, both really what Bobby and Elizabeth had touched on, is that one of the ways to have that long-term commitment is investing in sort of investing in the sort of people infrastructure to change, that building of civic muscle and belonging, that those kind of interventions have the possibility, to have that chain reaction that Elizabeth described, so that it's almost that you don't even have to personally be there for the next 10 or 20 years, but depending on what you seed first, if you're building that capacity within communities or partnerships, then it can lead to that chain reaction that can sort of then augment the impact. And I think that's a really sort of important point.
Yeah. And I think building on that, a lot of the sort of optimistic solutions focused language, I'm going to kind of recycle something I shared earlier, is these things are true as a process and an outcome, right? I'll go back to thriving and belonging. And yes, we are on board for change that is going to take decades, generations. The work is never done. It is always evolving. And I think there's some beautiful simplicity in case-making approaches that are not necessarily talking about doing different things in 30 years as you need to do right now, today, and in a way that feels accessible and not intimidating. And really importantly, this work is hard, burnout is real in a way that is energy giving. I know that might sound like hoo-ha, but we have to be able to show up joyfully in this work together, because that is the world we're ultimately trying to create together. So I think, Dr. T, to your question, there's ways to frame a case that is, I guess, sharing low-hanging fruit that we can do together now in a way that's entirely aligned, and sometimes even the same thing as that long-term North Star that we're also shooting for.
Great. And so for our last question on the table, I'd love to have folks respond to this question about the case in maternal health. Why don't you start?
Yeah, I was happy to see this question, and from a dear colleague, Sherry. It reminds me of a story. We were in a case-making workshop that Dr. T led, and one of the groups was specifically focused on maternal health and infant mortality. I mean, that was their title. And they recounted a story about being in a room. I think it was in Pittsburgh, with a community group of moms, expected moms, and the tension was rising. He was the maternal health expert and come in to sort of describe the science, and was visibly not connecting. And people were saying, "Why are you here, Mr. White Doctor? What are you going to do for us?" And he, conjured up his case-making skills, even though he didn't start where we would all have wanted to start. And his answer to them was, "I'm here because your baby is the most important baby in the world." And like everything changed, basically saying, we're not treating you like you're the most important person and this baby is the most important. But it was just that recognition of humanity and the idea that the system was never built to put that person, that life, as important, which was opening to be able to say, now let's listen to what we know about the patterns of black-white gaps in mortality and so forth. It wasn't that the data were unimportant, it's just that it had to come in a different order, and the humanity had to come first. That was one of the best case-making stories I've seen in a long time.
Yeah, agreed. Yeah. And I think everybody in the room, we all sort of, there was a moment in which, all of us like just recognized, we were just talking a couple minutes ago, when you're in a room and you realize that somebody's case making is gone off course, you're like, oh, maybe not so much. There's also that moment when you just feel it, right? Where somebody's made a case and they've really connected, and everything about your heart and head get aligned, and you know that they got it. Like there's a part of this work, and I have to say, from my vantage point of working with so many kind of dedicated case makers across the country, that I love it when you just get that, when you just hit it. Like there's that moment where you just know they've got what they need to influence the conversation in ways that bring new stakeholders to the table, that bring new champions to the conversation, and that engage even old stakeholders in new ways. And so I want to say, as we start to close today, that I'm just so excited about the work that y'all are doing. Casemaking is an investment too in your organizations, and all of you have been on this journey. And I just so appreciate you all, not just as friends and colleagues, but I think as folks who are really trying to help that. You all are sort of moving upstream and seeing folks who are trying to make a case around justice. And I just so appreciate all of you and your institutions. So Elizabeth, Bobby, Ruth, and Jane, thank you so much for sharing your wisdom with our folks today.
Thank you.
Thank you so much. Thank you so much for the invitation.
Yeah, and for the participants in the chat, there was a lot of really interesting things that came up.
For sure.
And for those of you who are listening, there are just lots of, as Bobby said, just lots of great resources and opportunities. Certainly on our website, there's all kinds of resources about case making, including the field guide. but all kinds of things that I would recommend in the chat. Some of the work, some of the toolkits that have been mentioned, some of the springboard, even the conversations we were just having about sort of thriving together, what that looks like. So take a moment, if you haven't already, to click on some of those links, to download some of those resources. And then I would say to reach out to some of our panelists if you feel like there's a connection that can be made in some of your work. We so appreciate all of you spending some time with us today, spending the better part of a little bit of your morning, a little bit of your afternoon with us. And I would say to all of you, happy case making. This is the moment for us to do some great and awesome work in the healthcare space. And I hope that you join us in doing that. Thank you so much, everybody. Bye-bye.
Thank you.
Thank you.
Everybody.